When you're looking at biology and physiology, there's another component to just health. And then there's health here, there's disease here, and then there's performance up here. And so my background is exercise physiology, and I was always interested in saying, what can we do to get performance? And in medicine, I mean, we're not looking really for performance, we're just looking for health. And we work with trainers and we work with sports teams, and we work with athletes that are injured and athletes that don't want to be injured. I mean, we do all that stuff, and again, the basis is how can we make physiology and how can we make biology the best so that you can perform at the maximum level for the maximum amount of time. It's always the recommendation after the season is done, you know, before you start training again, which is very short these days in pro sports, to come in and kind of get that system tuned up for a week or 2 weeks. And you know, a lot of athletes that come here, I mean, they see the difference. You know, they see the difference every single year, and you're getting a little bit more information every year, every time you come back. So we have to go through analytics on diet, you know, a little bit more in depth than just carbohydrates, fats, and proteins. We have to look at micronutrient levels, we have to look at hormone levels, we have to look at nervous system output, we have to look at oxygenation levels, we have to look at cellular metabolic systems, and we have to say, here is what you need to do, or this is the program that you need to run to get the maximum out of your physiology. And it's nice when the athlete doesn't wait till they're 35 to do that, because you can really make a lot of difference in exercise physiology and performance when you take a system and you know how to run a system, which is no different than taking a race car and knowing which gas to put in, you know, the aerodynamics, I mean, all these, and every single race car is a little bit different because the driver's a little bit different. And oftentimes in that first conversation on the phone, I'll say, I would like, you know, these hormones tested, I would like this micronutrient panel looked at, and I may like look at these, we'll say food sensitivity panels. So I'll usually have some of this, we'll say, you know, diagnostic testing done before the person gets here. So when they get here, we can go ahead and have a really good in-depth conversation on what do we have, what don't we have. And then normally that leads into what can we do to take your biology and bolster it as much as possible. And so at that time, normally we'll go and, you know, design a treatment program with electron supplementation, altitude, you know, oxygenation, and then IV therapy. I would say those are probably the big ones that we get. But in those, we'll say categories, there's 2 or 3 treatments that you want to do so that you can charge that battery up, keep the oxygen level high, and ultimately keep the micronutrients high, because you're just looking for, you know, energetic output. You're looking for your cell, and there's a lot of them in your body, to get the most energy out of that cell as possible. And there's a lot of technology that we have that allows you to do that. When you do all that stuff together, you get a system that you can run for a long period of time without having it break down. So injuries are much less, performance is much higher, stress for the individual is much less, and recovery is much better.